Welcome to Evening Rounds, a podcast that takes you behind the scenes in medicine. Tonight we are visiting with Dr. Ihab Dorotta, who describes the journey required to add stars to our quality of care and the life-altering impact of his mother while growing up in Egypt. Also, if you like what you hear tonight, please subscribe. Ihab, good evening.
Good evening.
It's a real pleasure to have you on our podcast tonight.
Mm-hmm. Thank you.
You know, there are some people in this room, like myself, where 4 years of high school may have not been enough. Then there are others in this room where you don't even have to do it. You skipped high school.
I did. It was a choice. We either had to go through regular Egyptian high school or accelerate the learning through a correspondence program with the University of London that required a lot of discipline, but also required my family to invest a bit of money because you'd have to go around, find some tutors and learn a few things. We did it. I managed to get the content in within a year after ninth grade. And went into medical school at age of 15 and a half.
Wow. So you are from Egypt.
That is correct.
Tell us about growing up in Egypt.
Very difficult. Average size family. We were only 4 people, me, my sister, and my parents. We did not have a lot. And so, but we learned to appreciate each other growing up in Egypt. But like I said, from a very young age, having the privilege to visit the rest of my family in Canada or Australia and things like that, I knew that I wanted to finish my education and get to practice medicine in North America.
So your mom was a big influence on your life and how you pray. Tell us a little bit about some of the advice she gave you on that.
Okay, so there's a few things that we may not know about Ihab Dorotta, okay? Not necessarily studious.
I don't believe that.
No, I left some studying till the last time. There was a lot of overnighters. And, we would pray before my exams. And so I would pray and say, Lord, give me, please give credit to my work and things like that. And she would stop me after the prayer and says, don't do that, okay? And I asked why. He says, if he gives you credit to your work, you're not going to get much. I would advise you that in the future, you pray for grace. Pray for, that he would give you much more than what you deserve.
I recently had a conversation with a mentor and friend, and I said, I think at some points along the way, I'm going to need a tablespoon of grace. And he said, Anthony, I think you're going to need a boatload. and the beauty of the Lord's promise is we're imperfect human beings, but through his grace, in his eyes, we are perfect. And that's a lot more than just a tablespoon of grace.
Yeah.
Amen. Yes.
Your mom is a very wise woman.
She is. And she, I don't know where to start, Kelsey. I'd pull on multiple overnighters trying to catch up at the end. And so he said, okay, I kind of need a couple of hours of sleep. And then I need to wake up at 2 a.m. and continue going. So who would wake you up at 2 a.m.? It would be my mom. And then I can't get into the groove yet. So we'll play a game at 2 a.m, a game of backgammon to get my mind rolling. She knew what she was doing.
Wow.
To get my mind rolling, and at 2:15 she'd go back to sleep, and I would now I'm fully awake, I can go back to study. So yeah, she had labored really, really hard for me and my sister.
The sacrifice of a mother. You went to Canada, and when did you come to the United States?
I went to Canada right after med school. So I had a 5-month vacation in Australia where I worked as a dishwasher and other things in restaurants and malls. But
I'm not sure that sounds like a vacation.
Yeah.
The beaches and surfing.
I bet that taught you a lot about certain aspects of life.
It did. And actually, even in med school, I would use some of the summers to come to North America and work in restaurant business. A lot of details that I would rather not share, but
So fast forward, Cleveland Clinic, do amazing things there, finish your residency, fellowship, and you're trying to decide where to go. Where did you hear about? I mean, how did you end up at Loma Linda?
Yeah.
I think there is a perfect alignment, for me at least, with Loma Linda. There is a verse in Luke 12 that says, to whom much is given, much is required. And there is a lot in my story that perhaps we don't have time for today, but I am the blessed winner of an American lottery green card. And so wanted to, okay, Lord, you must want a lot. Okay, so what that is finding a place where service is also paramount. And that is evident in Loma Linda's mission. Mm-hmm. When I first came in as a young faculty, I had a desire to pay back to the Faculty of Medicine in University of Alexandria, where I grew up, Alexandria, a small city, well, it's not a small, second largest city in Egypt, to operate on kids that would normally have died in the University of Alexandria because they don't have that expertise. We invited 8 folks from the University of Alexandria, 2 junior cardiothoracic surgeons. Typically, when you send somebody, you send the senior, and that's a habit of Egyptians. But no, they sent 2 junior cardiothoracic surgeons, 2 anesthesiologists, 2 intensivists, and 2 nurses. They stayed in Loma Linda for 2 months. And they saw the pre, intra, and post operative care for those patients. They actually were on our helicopter getting a heart from the East Coast back to Loma Linda. So they saw everything. 9 months later, there was a group of 17 folks, I believe. We went down to the University of Alexandria and we performed 17 cases of tetralogy of fallot correction successfully with the group that came and visited us earlier in 2 weeks, and then went back home. A year later, me and Dr. Bailey got an email from one of those young surgeons informing us that he did 181 additional cases successfully on his own.
Goodness.
That was not unique to Egypt. Loma Linda had done that in the past in Saudi Arabia. They continue to do it in Nicaragua and Malawi and other places, which again speaks to me about alignment in mission. Mm-hmm. Loma Linda does this. They reach out to places where it's either a financial need or an educational need or a humanistic need in general, and try as much as they can to step into that gap. Again, to whom much is given, much is asked.
And those kids would otherwise not be here.
Correct, Kelsey.
That's a beautiful story.
Mm-hmm.
My first interaction with you, I think I had been here, couldn't have been more than a month. It was on a weekend, and I was the cath lab attending for a heart attack patient. It was, as typical, a little bit hectic, and all of a sudden I heard this voice in the room. And I turn around, and it's Dr. Dorotta. And it was such a good voice because to know, I mean, it was clear that you were in charge. It was clear that you were going to handle that part of the situation, and you allowed me to focus on trying to open up the artery. Because a patient won't stop coding if the reason why they were coding is because the artery was blocked. Mm-hmm. And it's hard to do both things well at the same time. And it struck me. So, that presence and that appropriate confidence is very reassuring when you're taking care of critically ill patients. And so that was my first impression. I don't even actually know if I've ever told you that, but that was my first impression of Dr. Dorotta. I'll never forget it. But I wanted to fast forward a little bit because it segues very nicely into what your role is on campus here in part, which is running our critical care units and obviously the quality program that comes with that. But I wanted to ask you, because people listening to this may say, well, if I'm sick, aren't I critical too, right? Well, of course, everybody's critical when they come in. I mean, they're critically important to us, right? But why don't you tell us a little bit about what critical care medicine is and why is there a specialty for that and things like that?
Critical care medicine is a part of my practice that I love. To see a patient where either another physician team or their family are not expecting too much in terms of survival and or a good outcome, and then you, in a couple of days or 2 or 3 days, you turn around and says, we were able to do it, and he's going to survive, and he's going to not just survive, he's going to thrive and be just fine. So it just gives me that pleasure to step into a very critical, acute situation. And on that note, the story that Dr. Hilliard had shared, your attitude in the room is more important than what you actually do, because I've seen many of my colleagues get really nervous in acute situations, and there's 20 other people in the room, they all get nervous. But when people are, deal with that situation in a calm attitude, my nursing staff, my RT staff, my other physicians in the room, they all feed off that calmness and are able to perform better. So
it's like we discussed this ahead of time, right? Yeah. But you're 100% correct. And I'm grateful for you to be a mentor to our trainees and younger colleagues. There's not a lot of time for reflection in these situations, right? I mean, it has to be very protocolized and metric driven, which segues very nicely again to, I want to understand, when we talk about quality, I want people to understand what we're talking about, because I hear conversations like, don't take it to this automobile repair person, go down the road because they're much better. We don't often hear that about healthcare. You show up to a place and you expect that you show up there and you're going to get the care that you would get if you showed up to a different place. And I want to hear your thoughts about that and what we think of when we talk about quality.
That's a good question. We all, working in a hospital, think that the work that we do is the best. What quality platforms do is an external validation outside of our own inner circle that comes and looks at the cares that we provide for our patients. Is it best practice? Does it lead to the best outcome? That safe environment is what quality is all about. So how do we create guidelines, processes to remind our providers in real time what is the next best step to take in the care and management of a patient is quality? Because let's face it, we're all human beings, and there's a lot of medicine shows on TV, and we can remember maybe 8 or 9 things of the needed 10 things to do to a patient and miss that 10th thing, which could be the most important part. So quality is putting the infrastructure, the processes, having maybe the EMR remind you, the EMR is the medical record, remind you of all the stuff that is needed to happen to care for a specific patient with a specific disease, that you be reminded of it regardless of the time of the day, whether that patient shows up at 9 in the morning or 2 a.m. in the morning or again. So it's consistency in delivering the best care for every one of our patients at a regular basis.
And where can I go as a patient to find out the quality scores of any specific hospital?
Oh, they're all publicly shared. Okay. There's many platforms. There's the CMS star rating. There's the Leapfrog safety grade rating. There's the US News quality platform. There's the health grades, which we happen to be on the top 5% across the country for the past 3 years running. All of those quality platforms look at different things. Okay, it makes my work extremely difficult because now I have to look at 1,000 areas of care and measures. But there are 1,000 areas of care that already exist in Loma at a high rate. Why not showcase them? So it is a lot of work, but it's good work that leads to good results. Yeah.
When you joined kind of your role in 2018, was it? 2017. I mean, it's kind of unbearable to talk about, but Loma Linda was not in a good place with quality.
So that has a story too. So at that point in time, I was running critical care. And thankful for the opportunity to run critical care, by the way. Would not have been done without the confidence and trust of my chair at that point in time, Dr. Martin. But in March of 2017, I was called to the CEO office. Mr. Heinrich, Trevor Wright was there, and Dean Hadley was there. And my inner feelings is somebody did something in critical care. The gig is up, and
and you're going home.
It's like not the call you want to get
Pack your
necessarily.
bags,
I see
something
that,
like that.
Yeah.
I walked in and they said, well, we want you to help with quality. We realize critical care is doing okay. The rest of the hospital is not. And we wanted to help with quality. And at that point in time, we are a 1-star hospital on CMS. Now, you don't become a 1-star by doing random things. You become a 1-star, which qualifies to be in the bottom 4 to 6% of all hospitals nationwide, by doing the wrong things consistently over and over again. And that's where our quality journey began in March of 2017.
And now what are we?
We're thankful to the Lord. He has given us a lot of blessing. And we are on, I think, the 12th cycle of Leapfrog A for both the Medical Center and East Campus. And we just got results that I'm not supposed to share on air.
They're very good though, right?
All our 3 facilities are more than likely going to retain the Leapfrog A, including Marietta, which joined them this year, in the upcoming Leapfrog safety grade, soon to be told to us in October.
And where does that put us in this region?
We're the best hospital.
Stop there. Say that again.
Say it louder.
There's no doubt. We are the best hospital in this region. In fact, Anthony, I care about the quality for Loma Linda, but there's 34 other hospitals in the region. And
which one are we out of the 34?
We are Loma Linda, and there's no other Loma Lindas in the Inland Empire. We are the best hospital in this area, bar none.
You're a good preacher.
Amen.
It's not even close.
We should be humble about our success. We should have gratitude to the Lord for his blessings. But let's face it, we want to be competitive about quality.
Yeah.
I want all the hospitals in the region to be very good, but I want Loma Linda to be the best.
Yeah. I think it's compelling that, you identified that the way we got to being a 1-star hospital was because we had allowed bad habits to become how we operate. And now you've changed that entire culture to good habits is how we operate.
Change management is an essential skill. And how do you approach a group of providers, physicians, nursing, respiratory therapy, pharmacists, the list goes on and on. Plead to their ability to say, okay, can we take a look at the data? Can we compare ourselves to others? And can we be just open that there may be many ways to do our care, and perhaps one other way leads better results for our patients? That ability to convince somebody to change their habits of care is a real essential skill.
If you think about it, bad habits done routinely, that's like because if you talk to someone and you say they say, I'd like to have optimal health. Okay, that's a good goal. Fran, just pick a name, Fran. I don't know why I picked Fran, but Fran.
It's a great name.
What do you eat? I have pizza and pecan pie, and I'm not happy with the way I feel. Okay, how often do you have pizza and pecan pie? Every single meal. When you say it like that, it sounds ridiculous, right? Well, what we're talking about with quality of care or lack thereof is a very similar sort of phenomenon. You're doing something that you know is not going to produce the result you want, but then you're surprised you don't get the result you want.
I mean, let me tell you a story, Anthony, that is born in data. We talk about something called central line associated bloodstream infections. It's an infection of a line that we typically insert in one of the central veins in a patient to afford us access of different medications. Where did Loma Linda rank in terms of our total central line days compared to all other academic California medical centers, let's say 10 years ago? And I'm talking about the Cedars of the world, UCSF, UCLA. We were number 1. We used central lines more than anyone else, period. Okay. We had some consultants come in. They said, Dr. Dorotta, you have a just-in-case problem. What is that? There's no indication for the central line, and it's Tuesday today or Wednesday, okay? But just in case the patient needs it next Tuesday or next Wednesday, I'm just going to keep it in. And before next Tuesday or next Wednesday arrived, that line was infected. Okay. And so there's a plethora of certain practices like this that we were doing on a consistent basis that was not helping our patients too much.
This is weighty stuff. It's important. It's very, very important. What do you do outside the hospital to recharge the batteries, to continue the difficult change management conversations, to push for, as I've heard you say many times, there's not an end result in quality and patient safety. It's a journey, and you can move further and further up the road, so to speak, but you're never at the end. So that takes a lot of intestinal fortitude and all of that sort of thing. So what does Ihab do outside the hospital to recharge his batteries?
So there was a discussion with my wife when I first joined Loma Linda 20 years ago. I said, we get like 6 weeks of vacation or something like that. We're not going to go on 6 weeks of vacation. So, we're going to go on 2, 3, 4, but there is going to be a portion of my vacation where I'm going to continue to learn. Okay. And so a part of vacation time is for me to make sure that I am up to date with whatever is changing in healthcare. And every year I look into, okay, where is my area that I'm needing to help, whether it's anesthesia, critical care, now it's quality, operations, and I go seek out those extra courses that probably most physicians don't spend any time on. But recharging, what people don't know is I'm extremely competitive. And
wait, hold on.
Okay. Sports is it. Okay. So I'm
going to argue with the fact that people may not know you're extremely competitive.
I think you've illustrated by saying I use my vacation time to learn more, to be better.
But I think what you're saying is I'm actually extremely competitive outside of work too.
Yeah.
Yes.
Okay.
Oh yes. Okay. So I play soccer is my first sport, and
you still play?
I still play. We try and get with some church folk in Orange County. The last 2 or 3 times have not been very good because you go home and needing a lot of Advil for a lot of pain. But I still play. But in love with sports in general, I love to watch sports. Very competitive. I do fantasy.
Fantasy football, or
for sure.
Yeah.
Actually, there are some work leagues that I've won already, but they are underground and not supposed to be
bragging about that
on air.
It's not a T-shirt or something you wear.
So, but yeah, if it's curling and it's Canada versus Alaska, I'm watching. So, if it's competitive stuff, I'm watching. So I do a lot of reading, and I do a lot of sports.
You're also a very spiritual man.
I thank the Lord for that.
Tell us a little bit, because, I think it's really compelling. It's one of my favorite things, actually, and I don't even know if you know this, but I really identify the Loma Linda verse because of you, is Galatians 6:9. You got up at so many meetings that I sat in, and you said some really hard truths that we all needed to hear about quality, and you always ended it with that verse. And that so touched so many people that then when we came upon COVID and we had twice daily command center calls, we did not start those calls without reciting Dr. Dorotta's verse. Tell us about that verse and what it means to you.
Let us not be weary of doing good, for at the proper time we will reap a harvest if we do not give up. Galatians 6:9. When we
Amen.
first, when we first took over quality, my partner, Bren, and I talked about seeking other help because the work was enormous. Taking a look at the things that were needed to be done was a little bit moment for us. So I told Bren, I want to do a prayer meeting. And she says, what do you mean? I said, okay, I want to do it at an inopportune time. People wouldn't show up for it. It's 6 a.m, non-mandatory. So it's optional for just whoever is going to show up. And we're just going to pray for the institution. Okay, that's all we're going to do. In those meetings, I've asked, it was usually attended by maybe 7 or 8 folk. And then I asked them, we do want a verse to lean on. And so that's the birthing place of Galatians 6:9. And I have to apologize because I think Dr. Hilliard was also looking at that verse at that same time.
Do we have some competitive verse conversation here?
I think it was the time when Dr. Hilliard was talking about good trouble. And had a meeting with a few of our senators up on Capitol Hill. And those meetings led him to that verse as well. But
is that true?
It's absolutely true. It's a powerful text. It's had great meaning to me, and it's an example, I believe, of how the Lord's guidance in this institution is very evident. Yeah. And it's such and it speaks to all the things, like doing the right thing because it's the right thing. Mm-hmm. And even if it's hard when you're doing it now, just have faith, because in the end, you will reap that harvest. And the harvest isn't a harvest for Ihab or for Anthony or for Kelsey. It's harvest for our patients. It's harvest for our community. And that's what's so beautiful about it.
Yes.
I love that. I feel like I hear you a lot in my head.
Thanks, Kelsey.
I hear you reading that verse out loud at so many different meetings, and I do think it has truly become what we do here at Loma Linda.
Well, Ihab, I'm grateful that when you were at Cleveland and you were looking east, you came west. Mm-hmm. I think the Lord was leading you. I think Loma Linda is so much better off because you're here. You've inspired many to do the Lord's work, and that's the best thing anybody could do. Evening Rounds was an intentional name. We talked about it a lot. What should we call this podcast? And for me, Evening Rounds is a time of reflection and review of the day, see how I can be better tomorrow. But I always like to ask each one of our guests, when you hear Evening Rounds, what does it mean to you?
For me, Evening Rounds is about engagement. It's about community. When you have a large institution of thousands of employees, there are hidden spots to everybody. And to allow everybody that at least is inquisitive about all what the institution is about and what different cares occur in different sites that are hidden, Evening Rounds does that. To highlight the blind spots for even me when I watch different episodes, like I didn't know that was happening here. I didn't know that was happening there. So it's about community. It's about highlighting our values. It's about active engagement with not necessarily even leaders, people around our institution that are doing good work. And highlighting that is not just a sense of community, but is also motivational. Meaning when people hear that, there is something that, we underestimate this all the time, but there's something, you mentioned it a couple of times, Kelsey, that, is triggered in one's heart. Well, I'm going to do something different. Why? Because I'm convicted now. I know why I'm here. I know what this place stands for, and I know what I can contribute to it. I believe Evening Rounds is a very good vehicle for that.
Well, there's not much to say after that.
Yeah, thank you so much.
We really appreciate your time, and I ask the Lord to continue to bless you and your work here at Loma Linda.
Mm-hmm. And thanks for the gracious invitation. Thank you, Anthony, and thank you, Kelsey.
A special thanks to the sponsor of Evening Rounds, La Loma, who has provided banking services to the Loma Linda community since 1955. Their support helps us continue bringing you episodes focused on health, story, and mission.